right, so today we have a very special guest, Jonathan Parr of Parr PT in Austin, Texas. He specializes in treating patients with hypermobility, so he's here to talk to us a little bit about that. Thanks for joining us, Jonathan.
Thanks for having me. I'm excited.
So first of all, what got you into the field of physical therapy to begin with?
So what got me into the field, I've said this story a lot, but the short story is my sister was ill when I was younger. And watching her rehab process and seeing all the things that she went through, the complexities of it, the amount of time and effort that it took, and even the severity of the condition, really drove me into wanting to learn more about individuals with cases like hers, in addition to others with more complex diagnoses, conditions, injuries, those kind of things.
Okay. Where'd you go to school?
I went to school at the University of Texas Medical Branch in Galveston, Texas.
Okay.
Yeah. Graduated 2009.
Okay. So what got you into working with hypermobile patients or patients with Ehlers-Danlos syndrome?
Yeah, so initially my specialty was more so with brain injury and stroke. So the condition my sister had was more like lesion related to the brain, similar to MS. Okay. And a lot of my studies in school, my rotations, everything else was geared towards neuro, essentially. So my first job was neuro practice. And then after that, I went to a specialty outpatient clinic that also did neuro. So when I was there, they started getting more patients with dysautonomia, and I began seeing EDS. And that's actually what came in. None of us really knew what the condition was. We were, trying to figure out what was going on. And ultimately, that's how I got into treating it. And then once I started treating it, I just saw how complex it was. Not each person was so different. And it reminded me a lot of things that related to my sister in regards to like what doctors would say, like, as everyone has heard, doctors would be like, okay, it's all in your head, or this is not real, or, like the whole not really believing the patient thing, and which is a lot what my sister went through. And seeing that, I just my heart drew to that condition because I felt like they were really in need of a good advocate and someone that would actually take more time to figure out what's actually going on. And after that, I just have been doing it ever since. So.
Okay. Yeah, it's so true. Patients in that population, they really get dismissed by a lot of doctors, and it's hard to help them find practitioners in every different area that they need that will actually just listen to them, which seems like it should be a given that you go to the doctor for something, they're going to listen to what you're feeling and believe you about what you're feeling. But that doesn't seem to always be the case.
No, not at all.
Yeah. Have you been able to establish some relationships and find some doctors and other healthcare providers in your area that have been helpful to your patients?
Yes, I mean, surprisingly, there's a pretty big connection here in Texas for support, whether it's from a clinician standpoint, from like PT, OT, speech kind of thing, or an actual physician. So I'd say we have quite a bit of people, mainly from what I know in the Houston and Austin area, and that's where our practices are located.
Okay.
I know there are some people in Dallas and maybe one person that's just starting to get their experience with EDS in San Antonio. But overall, the support is much better here than I know in most states, but we do lack more of like surgical specialists, I would say, versus like, PCPs and those kind.
Right. Yeah, that's actually when I was living in Texas is where I kind of got my first exposure as a PT to EDS and how I got into it as well. And I did feel that way also, that people were able to find practitioners a little bit better. Even then here, I'm only about 30 miles outside of New York City. So a lot of people would think that it would be like really great care. And I have been able to connect with some providers, but similarly with orthopedic surgeons and things like that, a lot of times they're like, oh, you have EDS, I'm not touching that, I'm not gonna help you at all, you need to find somebody else. So that can be really frustrating.
Yeah, and it's I think it's tricky too. Excuse me. Just the amount of experience and like self-studying that you have to do before you treat these people, because the average person can't treat this condition in the way that would be more beneficial to the patient, just because it is so complex. There's a lot of factors that come into play than your traditional orthopedic education that we're taught in school.
Yeah. I don't know if you feel this way, but sometimes I feel like for people with hypermobility, it's almost, I feel like I'm treating them backwards compared to somebody in a more traditional orthopedic sense, where we're going to start with a lot of open chain things and then move to closed chain. With hypermobility, a lot of times I'm kind of getting into a closed chain position, kind of working on full body integration first and almost backing up from there.
Mm-hmm. No, I would agree. I think that um, the progressions are much different. And I think that a lot of, well, as PTs, we're supposed to be the master of movements and muscles and biomechanics and all this stuff. So understanding the biomechanics that are involved in whatever exercise is important, because in most cases, I always use squat as the example, that
Right.
a lot of times people will start with squats when most people EDS can't just start with squats. There's like four components that are missing. So
Yeah.
when you break that down, you have to understand, okay, how can I break this one exercise down into 3 or 4 components and
Right.
have them work on almost like part task training versus full task. And
Yeah.
that's what we've seen over time, is that's been more beneficial for patients, kind of gradually doing a slower progressive strength stability, whatever you want to call it,
Yeah.
program, versus jumping straight into something that is going to ultimately cause more injury, more harm.
Definitely. And something else I see within this population, I tend to see a lot of female patients in their kind of late 20s, early 30s. And a lot of them have told me stories about how when they've gone to a traditional PT clinic, it seems like they're received as like, oh, you're, young and healthy comparatively to a lot of other people in the clinic. So it's like, we want to get you doing squats right away and lunges and all of these things when, just because of the way that they look, they might, like you're saying, they're really not ready for some of those things. And they might need to progress even slower than the person who's maybe, 85 years old and had a knee replacement.
Exactly. Well, I think even aside from the movement, I mean, we know from a stability standpoint that the stability is not quite there in
Right.
most people with EDS, right? But it's the internal stuff that I feel like is missing from whether it's our objective testing, how we, I guess, coordinate interventions, but looking at things, what's going on with the autonomic nervous system, looking at vestibular spatial awareness type of stuff, looking at the way GI is working. When you look at all these basically day-to-day vital functioning systems, that plays a huge role in biomechanics, whether it's compensation, whether it's with, um, I would even say not only a compensation, but like fear of exercise that will drive more of a sympathetic response that could ultimately cause them to have different protective responses. And so there's a lot of things like that have been useful to integrate with programs, because we do have to take, it's not just the movement, it's how is the body receiving the stimulus? How is the body reacting to the stimulus? So one is to take it and one to apply it.
Mm-hmm.
And so with those things being considered, it allows you to make finer adjustments to these movements and exercises that allow the person more success, even though it's going to take a lot longer than what your traditional person would take. You have to remember, this person didn't just get this in a year. This is something that's been lifelong. So setting them up for success in the future is really important, and educating them on how long it might actually take, but understanding the small goals along the way, or the milestones that you'll hit by the time you get there.
Definitely. Definitely. So we kind of covered a little bit of it already, but are there any other common misconceptions about physical therapy or about movement in general for people with hypermobility that bother you or that you'd really like to dispel?
I would say, I think from what I've gotten from patients have been more so that patients are fearful because of previous experience. Like they just feel like it's just too hard. Like it's just going to make it worse. It's physical therapy. The word physical is like intimidating. It's like, oh my God, I'm not going to, be that physical. It's not about that. It's more of how we understand the brain and understand the way the mind body connection is. And knowing that you do need physical therapy, you do need these movements. I mean, medications and mindfulness and all those things are great, but that's not going to allow your body to function. Like there's certain hormones that are released with exercise that have to counter the other hormones like cortisol. It's like, as you start to understand the true like science behind how your body is, it functions on a day-to-day basis, it allows you to understand, okay, I do need this, but how can I do this in a way that's individualized versus most places give protocols like, oh, we do this protocol for everyone. Well, why? I mean, it's not the same person. Now, granted, like protocols are great just to have templates, but it's not specific. And so the importance behind the physical therapy part for people looking for is like find a therapist who's really going to tailor a program to you, not to everyone else, to you. And I think once you build that trust and that relationship with your provider, it's easier to start blocking out the fear and understanding that it is something that is beneficial, given if they do have that expertise in that condition.
Yeah, I would definitely say that's something that I see as well. And I think sometimes with any injury, but especially with this condition, some people can get the idea of, oh, well, I tried physical therapy and it didn't work, as if physical therapy is this one thing, is this one protocol. But really, there's just so many different approaches, and matching that approach with the person in terms of, like you're saying, the specific movements, but also the rest of the body and how all that's responding to movements.
Yeah, because that's the thing. I think the biggest thing is I feel like 99% not taken into consideration of the secondary diagnosis. Everyone sees hypermobility and they're like, oh yeah, it's just a joint and muscle. I'm like, no, man, there's way more involved.
Yeah.
There's things that are related to dysautonomia or POTS or mast cell or Chiari malformation. Like there's so much that are involved. And if you don't ask it or consider it, it's going to completely alter your results based on what you're trying to do. So I think that is, for me, that's the most important thing. Like I look at EDS, it is what it is for me, except for like vascular. Vascular is a little bit different, the way that you would approach it. But for the most part, even though they're all different, we're still looking at biomechanics. We're still checking the internal structures and systems to see how they're working, and then figuring out what fundamental or what sort of foundations do they need to build in order to get them ready for strength and stability. Like we're not even there yet. Let's figure out all this stuff. And I think when people feel more comfortable without that stress of like, oh my God, I have to go straight into exercise. No, it's like, let's figure out what's going on. Let's start low and then go from there.
Yeah, definitely. What do you find as some of the things that are most challenging about working with people with these conditions?
I think at least in my case, it's harder to work with someone who's had like 5 failed physical therapy experiences. It's like, what makes you think that you're any better than these last 5 people?
Yeah.
So I tell my staff this all the time. It's like, the first part is getting them to trust you. Like, let them know that you're not feeding them a bunch of BS. Like, let them know that, hey, you really are invested in their health and trying to figure out as a team to figure out what it is they can match. Because like my plan for someone may be too scary for someone. So then, okay, so what can I do to make you feel more comfortable? Like, where's your best starting point? I've had people say, hey, I've had this kind of treatment before. I don't want it. All right, cool. So let me get an understanding what your goals are, and then we'll see how can we move around that without doing that specific treatment or that specific movement. But I think that's probably a big one for me.
Yeah. Yeah, I would agree with that. I think a lot of times you can almost see somebody's wall up, and then at some point when you start to really build that connection and show them that you are different, you start to see it come down. And I think that correlates a lot with some improvements as well, once they're trusting you and buying into what you're doing and trusting themselves that they're capable of these things you're asking them to do.
And it's building the confidence too. Like you build trust and confidence. Like once they match what you're saying with what the results are, it's easier for them to buy in. I feel like the most challenging part is always in buying it. Regardless of whatever reviews you see on Google, it's still going to be different on the minute that they step in through the door.
Definitely. On the opposite side of that, what do you find most rewarding, specifically working about people with hypermobility and these related conditions?
I think what's most rewarding for me is when, like, for an example, people who have had bad, previous experiences that end up achieving much more than what their previous provider had said that they were capable of doing. Maybe doctors that have dismissed them from being able to achieve a certain goal, and seeing them, if they get back to running or if they get back to exercise and they get back to not even that, like at home family care, if they have kids. And that, I think being able to see someone go from a position where they feel helpless, and that's the word I use a lot, only because that's the word I've heard from a lot of people.
Mhm.
And being able to change that in a way that they're actually functioning, they're actually social, and just living their life. And I think once you see that, that's the most rewarding part, because I know that they took a lot of steps in the road or bumps in the road before they got to that point to get,
Mhm.
to get there. So for me, that's what it is.
Yeah, yeah, definitely. All right. So if somebody has hypermobility, what do you think are some signs that they should see a physical therapist?
Well, I think, I mean, the standard, whether it's, things that are too loose or things that are like what they people say popping out of place or subluxing, or even doing their own like Baton scale at home. I mean, you can pull that up online and just see, hey, where do I really fall? Now, it's it's accurate to a certain degree, but I'd say there's other factors you'd still want to consider. But it's just a good starting point to see, okay, how hypermobile am I?
Mhm.
Um, and I guess from there, just kind of moving forward with where you feel like you need to go from based on whatever symptoms that you have.
Yeah,
Because addition, because again, it's usually not just the hypermobile part; it's the
right.
other secondary stuff. Like, oh, do I actually get chronic headaches? Do I have GI issues? Do I have? And so pairing that up, I feel like gives people more information before they start doing anything.
Yeah, I agree. And I think that's something that as PTs we can be helpful because, especially with those other conditions, aside from certain things we can do, we can also refer them out to other people who can help them, if they're having these mast cell issues that are not controlled.
Mm-hmm.
And then maybe we refer them out and they get that under control, and that completely changes their life. That's great. Um, and I've also found, I've had the opportunity to work with some teenagers who have hypermobility. In particular, there's this family I work with some older children in the family who have been diagnosed with EDS, have significant hypermobility and pain, and they encourage their parents to bring their younger siblings in to see me. They're much younger siblings who definitely have some traits but have not experienced a ton of pain yet, but looking to figure out about ways that they can exercise safely and what they should and shouldn't be doing, which I think is kind of exciting in my mind. At least I think maybe I'm preventing somebody from having some pain down the road.
Yeah, yeah. And I think too, another thing is I always throw this kind of caution. I know a lot of people they feel like they need that diagnosis for them to feel like they need to move forward. And when it comes to hypermobility, whether they taught you with EDS or not, mechanics are mechanics. And so we're
Mhm.
still going to be addressing the same issues regardless if there's a tag on it or not. And so um, I think it's important that, if you're wanting to find out more, whether you get genetic testing, whether you go to someone who does a Baton scale on you, or whatever that might be, to understand that title, unless it's more so related to another secondary issue like mast cell or something that you're going to need to know from a medication standpoint, most of the
Right.
times you don't need that diagnosis per se to actually start your journey towards recovery.
Right.
Yeah.
Definitely. That's something I feel as well. And a lot of times I'll have patients who are in that stage of, they think something's going on. They're not sure if they should pursue genetic testing. And the way I kind of say is, unless you really need that for some reason, or you have these secondary diagnoses, I think spending your time and energy and financial resources on actually feeling better is probably a good first step, at least to try, rather than just spending time and money and financial resources to say,
Mm-hmm.
for somebody to say, yes, you have this, or no, you don't, which seems to be a lot of times. I know there are some criteria, but diagnosis of opinion based on the provider.
Yeah, I mean, I 100% agree. I think the only, I guess, loopholes, like if you're wanting to have children, you want to make sure that you're not passing anything down, then I'd say, yeah, go get the genetic testing. But
Yeah,
if it's just related to yourself, there's not really any reason at that point in your recovery process.
right, definitely. So as far as your practice goes, the patients that you treat, are there any qualities that you find that are common between the patients that are most successful in your practice?
Do you mean the traits that bring more success, or just things that I commonly see with patients?
I'm going to say both.
Okay. I would say the things I commonly see with anyone with hypermobility issues is headaches, stomach issues, and some sort of joint, whether it's like hip, shoulder, some like major instability, right? And as far as and also vestibular issues is a big one. There's a lot of people that have had concussions, and also it's some research that we're doing right now is like how EDS, because of the elasticity of the tissue and things like that, like is it really presenting like post concussion based on how it's formed in the brain and this kind of stuff. So I think that 99% of the people do lack that mind body connection, and that's where everything is like thrown off. And I think the things that have made people successful is really starting on the fundamentals. I've practiced before I developed our techniques that we have at our clinic. Is I've done where most people will start off strengthening. I've done where we've done almost little to nothing, but finding that way to really integrate those three systems that I mentioned I found like that's the most successful thing that I've seen with patients, and it's showing for the last 4 or 5 years now.
That's great. That's great. All right, Jonathan. So if somebody wanted to learn more about your practice, or somebody's in the Houston or Austin area and wants to work with your practice, what's the best way for them to reach out to you?
Yeah, they can go to www.parrpt.com. So PARRPT. We do have a 3 Systems blog. We put a lot of educational topics over there that people can check out. We have a lot of informative stuff linked through our YouTube page, and we have basically on the side, we have various ways that they can ask questions or get information, those kind of things.
Great. So I'll definitely put a link to that site in the show notes from this. Jonathan, is there anything else that you want to share before we wrap this up here?
Yeah, I think, and this really goes out to everyone who either has family members with hypermobility issues, whether you have it yourself, whether you've gotten the actual diagnosis, the diagnosis of EDS, is I'd say be positive about where you can go. And I know people really go through some tough times with it. And, again, not every case is the same, but just trust that there are a lot of good, there is a lot of good that can come from beginning, rehab and, more movement specific stuff. And that, it's a matter of finding the right person and developing that relationship, and just being patient with the time that it might take, but being consistent with where you want to be.
Definitely. Thank you. That's definitely good advice. And I think a lot of people could use to hear that.